With COVID-19 cases rising rapidly and India now has the third highest number of coronavirus cases in the world, several states have gone for a partial lockdown and hence a lot of questions are being asked about India's coronavirus management. With me is someone who is involved and is planning the policy, India's Health Minister, Dr. Harshvardhan. Dr. Harshvardhan, thank you so much for your time.
Welcome.
Sir, how far are we from peaking? Because cases are galloping towards 30,000 a day. Isn't this alarming?
I don't think so. You see, it is a matter of concern, but it is not at all alarming because you have to look at it in the right perspective. When you start your question with the fact that we are probably number 3 in the whole world, then you have to consider multiple things. Number 1, we are a country with second most numbers in terms of our population in the whole world. That's number 1. It's a country of almost 1.35 or 1.38 billion people, with almost 35-36 states and union territories. You can say so many countries within the big country that way. And I think from any parameter that you judge it from, we have done far better than the rest of the world.
Fine enough, Dr. Harshvardhan. Then tell us, how far are we from peaking and where exactly are we on the coronavirus curve?
I think it's very difficult to comment about exactly peaking, because peaking is something which may happen at different times in different places within the country. But I personally feel that we are very thoroughly in control of the whole situation. Now, everybody in the country, almost all the state governments, they are very aggressively handling the corona menace. They by now know quite well how to deal with corona. At the national level, we have so much of experience now of handling the whole thing. We know each and every place where we have the disease right now. Even the worst of places, we have been able to handle them so well that they have become living examples. They are being quoted not only by us, they are being even quoted by the World Health Organization.
Again, the question is, when I last spoke to you, I spoke to you on the first day of lockdown 3.0. We are now in unlock phase 2. There are several states which are seeing partial lockdown. Several cities like Pune, the examples of Thane, Bengaluru, Patna, they have gone for a lockdown. The question is, did we open too soon?
I don't think so, because you see, ultimately you have to have a balanced approach, and the government of India had done so much of academic exercise. We had taken everybody on board, we had consulted all experts, and after the lockdown 1, lockdown 2, 3, 4, I think you have to appreciate that our Prime Minister took bold decisions. Even for the unlock 1 and unlock 2, it was a big decision to take, because there was something which you have to strike a balance between ensuring that we start looking at the economic front also. It was a very bold decision to have thought of millions of migrant workers to be transported, to be sent back to their respective homes and districts and their villages and their native places. So ultimately you can't keep the country in a lockdown stage forever. And what you are talking about right now, since the states have learned, you see, there are places where the people in the unlock situation have not behaved in a more disciplined manner the way they should have behaved.
But sir, this is going beyond containment zones. Like Bengaluru will be going for a total lockdown. Such is the case with other cities as well.
There is, you see, after all, what is the ultimate goal? Ultimate goal is to win over corona, to control corona, to protect people from corona. And if you find that some liberalization of the strategy and the norms that the people were supposed to follow, they are not following them, and because of that the situation doesn't, instead of improving, it starts worsening. So there is no harm in revising your strategy at localized places. It's not that every state in the country is doing it. It's only very few states at very few places where they have enforced this
So we have seen
lockdown
how
again for very
cases
few days.
have grown exponentially ever since we unlocked. So the question that is being asked often is that did we unlock at a wrong time and go on for a complete lockdown again at a wrong time?
I don't think at all on these lines. I think lockdown was one of the most, I think, wisest decisions that was taken by the government at the most appropriate time. And I would always laud the initiative and the vision of our Prime Minister. You look at the things, the way things were growing. When you say exponential, I don't think that we have had a exponential growth at any time. This number that you talk about right now, it's not an exponential growth. It is still a plateau. Maybe the number of cases, they have increased in some places, and there are at different times there had been very specific reasons for this rise in number of cases. In the initial phases in March, in the middle of March, it was the Tablighi issue which got this rise in numbers all over the country. Then in the initial stages when we enforced the lockdown, there were some issues because these migrant laborers and all, there was some unrest at some places. Then after in the unlocked period, then it was all about these millions of migrant people being shifted. And now the numbers that you see rising, a large number of this is because of the liberalization of the strategy of testing. You see, right now, anybody can go to any doctor, just have a small prescription that he has to be tested. He goes to a hospital. He goes to one of these 1200 places in the country. He can be tested. And for testing also, you see, we are now using all sorts of strategies. It's the RT-PCR test is there, antigen test is there, the ELISA antibody test is there, and 97% of the country right now, within 3 hours drive, you get a place where testing is possible. This is the same country where just a couple of years back, the swab sample had to be sent to America for the virological results. And from one lab in Pune, we have gone up to 1200. We are in a day testing almost 2,80,000-90,000 people. And you see the...
Are you looking at increasing that number?
Oh,
because
yes,
since
yes,
you talk
yes,
about
yes.
3
You
lakh.
see, I just try to recall and bring it to your memory also that in May I said very modestly I said we want to go to 1 lakh by 31st of May. Almost by 10th of May we had already gone up to 1 lakh. And today when we have already almost gone up to 2.89 lakhs and our capacity is something like 3.75 lakhs per day. Our ambitious target now on which we are working and striving is to, in next say 12 weeks or so, we want to go up to 1 million tests a day.
That's a huge
and yes
ambition.
And it's not only a dream or an ambition. We are working and striving hard every day. I tell you, if I give you a data right now, you talk about this same data in the afternoon, you talk about the labs number in the evening, you will find there is an increase.
Okay, Dr. Harshvardhan, since you're talking about 1200 testing centers, I'm looking at this letter that was jointly written by Union Health Secretary Preeti Sudan and ICMR Director Dr. Balram Bhargav. They had talked about how several states and union territories, there was this thing of grossly suboptimal level of testing. Why is that so? Is it because, sir, certain states do not want to present the right picture and hence they are going for less testing?
You see, I will agree with you that there had been some instances of some states where we felt that the number of tests that should have been done, they are probably not doing. You see, right now, the WHO advocates that there should be a minimum of 140 per million of tests that should happen. In our country, we are probably doing right now
Yes.
198 per million. But there were some states where it was not conforming to those WHO standards also. And we also, with our feedback from the systems, felt that there was a need to push and maybe push it a little harder with these
You know, states
that-
like Bihar, sir,
I would not
UP
like to-
and several states
no,
which have the lowest testing.
I would not like to name particular states, whether it is UP, Bihar, or whether it is Telangana, or whichever state it was. But we have been continuously, number one, supporting, number one, providing everything possible that they need to do. All these labs have been created with the help of the central government all over the, and we are still in the process of expansion. If you are doing more testing, you are in fact picking up more people at the earliest possible stage.
That's right.
And if we pick up a person with an infection and just isolate him, quarantine him, shift him to a hospital, start the treatment, mortality rate also goes down, and then the risk of spread of the infection through that person, it also, this is the point that we have been emphasizing again and again.
But why are the states not doing it?
No, I think there has been a significant improvement. I just to cite an example, where we are sitting it's the capital of India. Delhi also was just testing 5,000. So one day in his regular reviews with the Prime Minister, he has been reviewing the things so meticulously, so sincerely, so committedly, so dedicatedly. I think hats off to our Prime Minister, and that's from the day one. So in one of the meetings, even 2 days back also, he had a review of the whole thing. In the last review, he mentioned that the Home Minister and the Health Minister should actually get in touch with the Delhi government on a dynamic scale, then review everything in detail and try to coordinate on a you can say at a better plane, and with that coordination and cooperation revisit the activities that are going on in Delhi and see that we take charge and control of Delhi in the best possible manner. From 5,000 tests a day, we have got the things enhanced. Last week, the average was 22,000 tests. And we, in fact, diagnosed all the, you can say, either the bottlenecks or the loopholes or the complacence or whatever it was. We improved the bed strength, ICU strength. We created these COVID care centers, the capacity of which is almost 10,000 beds.
Yes, sir. So the fact that you are saying that several states are not testing enough, and that is a reality, although there is a push by the center. Do we really have the correct picture of the spread of the coronavirus, particularly in rural parts of India?
Yes, I think so, because number one is about the, I have said it on earlier occasions also, I have to compliment the villagers and the people living in almost I think 6.5 lakh villages in this country. They have done commendably well as compared to some of the people living in the cities and towns. They have behaved in a much more disciplined manner. They have been able to handle the migrant workers returning back in a much more committed fashion, and the infection hasn't spread to the villages, which was actually that was something that we all had this apprehension. Even the media used to talk about it. The experts who used to come from outside, they used to, if you recall, an expert from America, he had predicted 300 million cases by now in the month of July. Now he has revised, he says now it will be 200 millions by September or so, and 5 to 6 million deaths. So all those things have, I think all those predictions, mathematical calculations, they have all failed, and we have checked it You know, the ICMR did a sero survey of the whole country also. We had chosen, I think, something like 85 districts. We did that. It was a significantly a big survey. Recently, we have done a survey, and now we are again planning a survey for the whole country. All datas and all, you see, feedbacks, they very strongly, significantly point out that the villages have performed far better than the rural India has. Rural India's performance is far better than the urban India's performance.
Sir, you know, since you're a doctor as well, we are 6 months into the pandemic and still there is no treatment protocol or one medicine which can be seen as a wonder drug. Do we really know this virus in terms of how this, can be treated in any way?
You see, as far as the treatment part is concerned, whatever best could be done, that is being done, number one. Whatever drugs are available to the whole world, we have also made them available to our country. I think you may be mentioning about remdesivir and favipiravir, etc. All these drugs and other injections. We have made them available to you. Only asked me a couple of months back, 2 months back, what's happening to this remdesivir, and I suggested to you that by this date we will give you the clearance from. But much before that, we got the clearance. Now we have the 3 drug companies who are, in fact, manufacturing it, supplying it to the. So, and then in the fastest possible manner, the drug controller has given approval for almost 150 types of trials for different drugs, etc., etc., or the plasma therapies, etc. Even for almost 242 new kits. You look at the situation that's in last 2, 3, 4 months, from a situation where we are not manufacturing any kit, we were not manufacturing any PPEs, we were not having these facilities for other things in the country. Now we are having everything in the country. Most of these kits now, they are available on the GEM portal, and the states can directly procure many of these things.
So you talked about remdesivir, and Cipla has announced manufacturing of the generic version of remdesivir, which is being named as Cipremi. What will be the cost of this drug? You know, because remdesivir cost is very high, and there is black marketing that is also going on.
You see, as soon as number one, we have made, you see, from the government of India side, whenever we have heard about this black marketing going on in the initial stages, we pushed it hard that we give the approvals as fast as possible for manufacturing. We did that last month. Then with Hetero and this Cipla, and I think the third company is the Mylan, which is basically manufacturing. We ensured that they provide these drugs at a reasonable price. And then when we heard about this black marketing, number one, the drug controller of India has written very strong letter to all the state drug controllers and to act within 36 hours and ensure that all systems are put and tried in the best possible manner, in a very stringent manner, to ensure that nobody is allowed to black market the drug. You have heard about people being caught in Mumbai and in Surat. They have been arrested, and similarly we have instructed these companies to put on their website the availability of the drug and the places where it is available. We have asked them to put a 24/7 helpline where anybody who is in trouble, who wants the drug to be given to his relative, he can contact the online. And we are very, very meticulously monitoring this situation also, that we don't allow any black marketing in the
there is the new controversy that has erupted on the vaccine, with the ICMR giving that deadline for a vaccine by 15th of August. Do you think that will be the right approach, given the fact that there has to be trials that have to be conducted? Realistically speaking, when are you looking at a vaccine?
I think, number one, in one line, I would say that whatever ICMR wrote was probably misinterpreted, and then that also they subsequently also clarified. At the moment, you know that it's almost If I go to the exact number, it's maybe in smaller ways, at least up to 2.5 dozen vaccine candidates in India have started working about it, but at least half a dozen to 1 dozen are serious discussion, serious stages, and amongst them, the two are the ones where they are in the process of entering into the clinical trial phase, where they have been given by the approval by the Drug Controller of India. But we are, following all standards of discovery or the development of the vaccine, and that's also we are doing for the new drugs or the repurposing of the drugs. So it's very difficult to predict the time when we will have a vaccine, but because with my experience as a doctor or whatever I know as the science behind it, as a science and technology minister, as health minister also, it may take a few months, or maybe it's very difficult. But I can assure the country that whatever our Indian scientists and our Indian drug companies are doing, whatever the ICMR and the drug controllers support to that, whatever the support of the scientific community is there, we are working as sincerely and committedly with the greatest of enthusiasm, putting our heart and soul into ensuring that as
So
soon
are
as
you looking at
possible-
some kind of timeline then?
It's very difficult to give any timeline. I think, but the only thing that I can say is that our scientists and our people in the drug industry, they are also very enthusiastically working, because everybody is keen that today if we have corona, if we get a vaccine in the next few months or so, then of course you can help the people, you can help the society, you can help the community, you can start giving it to the most vulnerable groups in the population, and then start improving the immunity levels of the
Last question to you, Dr. Harshvardhan. Several states have said that there are cases that are coming in, they do not know the origin of those cases. Then why is the center shying away from declaring community transmission?
I think this question has been asked so many times, not only to me but to the experts also. From all parameters, from all perspectives, this question has been visited so many times by our people. It has been even visited by the World Health Organization also. You see, right now, there is no definite, even the definition of community transmission. In a country like India, and with the data that we have and the processes that we have followed to evaluate the spread of the infection, every time we try to answer this question and try to investigate this matter, we come out with the answer that as on today, there is no community transmission in the country. There may be few places where you have slightly more localized transmission in some pockets. Say, for example, it was Dharavi. There also it is so well controlled now. So, and whatever we are saying, it has not been even disputed by even the organizations like the World Health Organization. So I can assure the country once again, with utmost confidence and conviction, and with data's backing what I am saying, that as on today, there is no community transmission in India.
All right, Dr. Harshvardhan, always a pleasure to speak to you, sir. Thank you so much, and thanks so much for watching.
Thank you so much.